Cataract. A cataract is a lens opacity, clouding or opacity of the crystalline lens that impairs vision. Cataracts are usually bilateral. They may be congenital owing to intrauterine infections such as rubella and cytomegalovirus or inborn errors of metabolism such as galactosemia. Galactosemia, galactosemia. Traumatic or secondary to systemic disease such as diabetes, myotonic dystrophy, atopic dermatitis. Systemic or inhaled corticosteroid treatment or uveitis. Senile cataract is by far the most common type. Most persons over age 60 have some degree of lens opacity. Cigarette smoking increases the risk of cataract formation. Pathophysiology and etiology. Senile cataract commonly occurs with aging. Congenital cataract occurs at birth. Traumatic cataract occurs after injury. Aphakia. Aphakia, absence of crystalline lens. Additional risk factors for cataract formation include diabetes, ultraviolet light exposure, high dose radiation, and drugs such as corticosteroids, phenothiazines, and some chemotherapy agents. Clinical manifestations: blurred or distorted vision, glare from bright lights, gradual and painless loss of vision. Previously dark pupil may appear milky or white. Diagnostic evaluation: slit lamp examination to provide magnification and visualize opacity of lens. Second one, tonometry to determine IOP, that is intraocular pressure, and rule out other conditions. Third one, direct and indirect ophthalmoscopy to rule out retinal disease. Fourth one, perimetry to determine the scope of the visual field, normal with cataract. Management general. First one, surgical removal of the lens is indicated. A patient with one cataract can usually manage without surgery. If cataract occurs in both eyes, surgery is recommended. When vision in the better eye causes problems in daily activities, surgery is done on only one eye at a time. Cataract surgery usually done under local anesthesia. Preoperative eye drops produce decreased response to pain and lessened motor activity. Neuroleptalgia. Oral medications such as may be given to reduce intraocular pressure. Intraocular lens implants are usually implanted at the time of cataract extraction, replacing thick glasses that may provide suboptimal refraction. If intraocular lens implant is not used, the patient will be fitted with appropriate eyeglasses or a contact lens to correct refraction after the healing process. Surgical procedures. There are two types of extractions: intracapsular extraction and extracapsular extraction. Intracapsular extraction, the lens as well as the capsule are removed through the small incision. Extracapsular extraction, the lens capsule is incised and the nucleus, cortex and anterior capsule are extracted. A posterior capsule is left in place and is usually the base to which then intraocular lens is implanted, IOL. A conservative procedure of choice, simple to perform, is usually done under local anesthesia. Two types of procedures for extraction are: one is cryosurgery, second one phacoemulsification. 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 Cryosurgery, a special technique in which pencil-like instrument with a metal tip is supercooled -35°C, then is touched to the exposed lens, freezing it so the lens is easily lifted out. Phacoemulsification, the mechanical breaking up, emulsifying of the lens by a hollow needle vibrating at ultrasonic speed. This action is coupled with the irrigation and aspiration of the emulsified particles from the anterior chamber. Second one, other procedure is intraocular lens implantation. The implantation of the synthetic lens, intraocular lens, is designed for distance vision. The patient may wear prescription glasses for reading the near vision. Intraocular lens implant restores binocular vision. Sophisticated calculations are required to determine the prescription for the lens. Numerous types of intraocular lenses are available. Designs and materials change as new developments occur. Advantages of intraocular lens include the following: provides an alternative for the person who cannot wear contact lenses, cannot be lost or misplaced like conventional glasses, provides superior vision correction and depth perception than glasses. Complications specific to implantation. First one, pain from inflammation of various eye structures, usually controlled by non-steroidal anti-inflammatory drugs, but systemic antibiotics and immunosuppression may be required. Second one, rosy vision, glare due to keeping pupil from full constriction. Excessive light enters pupil, causing a dazzling of macula, that is minute corneal opacity. Third one, degeneration of the cornea. Fourth, malpositioning or dislocation of the lens. Implants may be not advisable for patients with severe myopia, history of chronic iritis, retinal detachment, diabetic retinopathy, glaucoma, and complications during surgery. Contact lenses. Extended wear contact lens is the option for those who do not receive intraocular lens implants. They restore binocular vision and result in magnification of images in the range of 7 to 10%. The patient will need to take the lens out for cleaning periodically, or if the patient is elderly or debilitated, he or she will need to follow up at intervals for cleaning at the ophthalmologist office. Complications: blindness. So the surgical procedures. Treatment include general procedure, surgical removal, contact lenses, cataract surgery, intraocular lens. In surgical procedure, intracapsular extraction and extracapsular extraction. Two types of procedure, surgical procedure. One is cryosurgery, phacoemulsification. Next one is intraocular lens implantation. Third one is contact lenses. Thank you.